know, I'm passionate about the heart. Not just the heart is we know it with love and the beating part of it. I'm actually passionate about taking good care of it and living a lifestyle uh, as much as to in my control to keep it healthy. With doing that, I want to share information that I have gathered to help you as well. Because sometimes it's better to have individuals with you, you do it as a group to de stress. Because even though stress is not part of the written document or most of the information we see when we read about heart health, but it does play a big part in it because no matter who you are, you have some kind of stress. We just choose to manage it differently. And because it's different for everyone, it could be good stress where you're meeting your goals, you're being productive, but it's something that's constantly on your mind. Or it could be the negative stress where you have bills, you have kids, those things are still stress related. As you know, I believe in balance, and balance is the key to almost everything we see in around the world. We have impacts of everything from global politics, health. I mean, everything impacts us all the same. We're all human. You'll hear me say that. And on this channel, we are not what you consider religious, whichever way you want to put it. We love everyone. We accept everyone religion because when it comes down to it, when we talk about love and how to treat others and how to be a impact on the community and our environment, we know that love conquers all. And of course, to share good information, good news, that is always welcome, no matter who we are, what religion you share. So today I wanted to go over, I made some slides for you on Heart Health Training Day, which is today, or the day that you're watching this video. Now, here at Holistic Health and Financial Services, we believe in changing our lifestyles and making lifestyle improvements. We are going to help our communities, build stronger communities while we're building our hearts and changing our lifestyle for long term and to help with our current health issues. So, as we know that as a CPR and trainer, we have a lot of information that is out there, and some of the training is provided to you so that we can avoid things like strokes, heart disease, and high blood pressure. We know hypertension is a prevalence and has always been that for some years now. There are some areas that has more hypertension according to the CDC. And that is a link you can go to in order to get the information, which is a lot of the information that I am providing here in our video. High blood pressure is more common than we know, especially in the United States. We wonder why. I mean, you have all of this different uh, issues from racism, politics, how there are disagreements, Republican, Democrats, independent. We have all of the eating that has GMO. We have organic that may cost a little bit more. or when you want to eat healthy is a little more and you don't have it financially. So we have financial issues. And not to state that we have other health issues that arise when we have high blood pressure, which is sometimes known as hypertension. Nearly half of adults in the United States have hypertension. And we know that hypertension is sometimes not diagnosed because that person may not know that they have high blood pressure, especially if they have not been diagnosed with it. Hypertension is about 1 in 5 adults that has it and they're not aware of it. Okay, so this is where we have to take control of our health and know how we're feeling when we're not feeling right or when something is not normal, listening to our bodies, knowing when to contact a provider, and knowing how to use your insurance so that you will not have to pay for everything that is offered through your provider. This way, if we're doing preventatives, we're being proactive with our health. It's a group. It's not just a one person. It takes a crew. And this is why we're getting in the communities. We're going to make a goal to make sure that we try our best to help those that's in needs and some of those that may not be mentally aware or even mentally able to take care of themselves. So we got to advocate. So there is a greater percentage of men, over 50% have high blood pressure than women. So women right now is 44, and I think this was back in 20. This is the most recent one, so it would have to be behind maybe 2021 information. Okay, so with the COVID and everything, those numbers may be a little higher, and of course we know it depends on where we're getting the information from. So the data that I did look up was 2022, so it is the most recent available on CDC. So as we know, high blood pressure is common. So even though we have a number of different races that is labeled here on the screen, however, when it comes down to it, we're all human, and the goal here is to help you know when your blood pressure, to encourage you to go to your professional doctor, or your nurse practitioner, your provider, whoever you see for medical help. So as we know, and even though this is not what I call religious, because um, in the past, I've talked about religion and I have some different music going on. And I just bet, I'm almost 100% sure that those that consider themselves religious totally said something about my background music. But you know what? That music is not all in my heart. I like music. I love all kind of music, just like I love everyone, no matter who you are, what race you come from, how you look, any disability. You know what? If you're breathing and you're walking and doing all the other things humans do, I love you too. As long as you don't treat me wrong, because I'm human. And if I can smile at you, you should be able to smile back. And that's just the way I feel about that. With that being said, we are still focusing on this hypertension and their conditions and how to get it under control. So here is a numbers. If your normal range when you stop at the store, or if you have a blood pressure monitor, you should be recording it. So if you're taking your blood pressure in the morning just to see if it's high or low, and really to get familiar with how you feel when your blood pressure is on a higher range, because some of us can actually feel when our blood pressure is not in the normal range. So we know normal blood pressure range from 120 to 80. And if you're taking your blood pressure in the morning and you take blood pressure medicine, your blood pressure should not be at 140 over 90. That means that something you may want to record on a regular basis and see how long and give it to your provider so you can talk to your provider about it. Now, the 130, 139 over 80, 89, if you're not taking blood pressure, you still want to talk to your doctor about those numbers so you and your doctor can see what's a good number for you. Because some of us have and do activities that maybe the provider may relate, and that's what he is there for, and that he and she they are there for to provide the information for us, we hope, to help us to monitor and control, or help our medication control our have better outcomes with our blood pressure medication. Because you don't want to just take blood pressure medication and it's not doing nothing for you, nor do you want to take blood pressure medication and gain have the side effects to add to your health condition. If you are doing that and your blood pressure or statins are adding or making things numbers higher, or whatever the reason, you should discuss that with your provider and ask if and how you can avoid having or adding new health condition from your medication. So that's the whole point, is for us to take control of our own health and try to help our provider along with the medication to be a resolution instead of us a solution to the problem. Okay, so as we know, when we have high blood pressure, not everyone have bad cholesterol, but sometimes they do go hand in hand. And almost 2 in 5 adults in the United States have high cholesterol. So right here on the screen, again, I get my information from sources of CDC, and information that I know is available to you to read yourself and do your own homework. But the numbers are here if you want to, if you're listening and not looking. So normal range for your cholesterol, usually the high cholesterol, you have, when you get your labs, they have those little red numbers. So you want to pay attention to that. So we will go over, provide some information that's basic to you to help you maintain or control and encourage you, hopefully, to take control of your health. With high blood pressure, and why it is so important that we not ignore it at any time, we have to know the consequences for ignoring our labs, ignoring our family history, ignoring side effects that we may have from medication, and know what it is and why it's there. That decreases a lot of stress. Um, so sometimes we can relax when we know the reason, we're not so stressed out about it. because we can do something about it. So with that being said, we have other things that if your blood pressure is not monitored or what have you, you have hereditary side effects from medication. We have the type 2 diabetes that we don't ever want all of these three, but sometimes if you have one, you have the other. Sometimes you have two of the conditions, and sometimes some people have all of it. So with that being said, know your numbers. And you can look back in the following videos. You'll hear me talk about knowing your numbers, how important it is. So if you have a glucometer, you can check your blood sugars if you're pre-diabetic. That's always good to have. If you're not a pre-diabetic and you just want to avoid it because your relative or family or someone you know is a diabetic, you probably can watch their lifestyle and see how they become it. Now, just because you're overweight does not necessarily mean you have these health conditions. Again, sometimes it's just a hereditary. Sometimes it is a factor of stress. And sometimes it's medication. This is why we just want you to be alert, be aware, because knowledge is power. And when you know better, you do better. Of course, Maya Angelou tells us that. She told us that. And bless her in heaven. So with being diabetes, I have these numbers here. You have your pre-diabetic numbers, and then you have normal range, and then you have diabetes. Okay, so if we can maintain a normal lifestyle, you can actually avoid a whole lot of this information that I am provided or just provided. How we do that? Now, as far as I'm concerned, and I don't know about what other videos you look at or who you talk to, who your provider, in order for me as a human being to go forward, I have to accept reality for what it is. Okay, so once we accept that, we decide we either going to do something about it or we not. Okay, so I'm hoping that you do something about it. Don't give up. Even if you do something about it, it doesn't work the first time, or it seems like it's taking a lot longer than what your goal. Talk to someone. That's it. Talk to your provider. Talk to a dietitian. Talk to someone so you can actually kind of figure it out to how you can take control of your life. And sometimes we do need help doing that. So in order to do that, again, this information is available to you on the CBC because I am not a doctor. I am experienced in some areas in the medical field, and of course, I've had some, as you know, some life changing from eating meat to being a vegetarian. And I'm a vegetarian in work. I'm not 100% like I want to be with the raw food and things like that because, as you know, it's a challenge no matter what. But that's life, okay? And as the videos go further, I'll kind of share my experiences. But for this one, okay, we are going to focus on your heart health. Every year, Americans suffer from about more than 1.5 million heart attacks and strokes. The good news is that you can help reduce your risk and improve your heart health by following the ABCs, right? So, part of the CBC is stated where I got the information, gave us some kind of alphabets to follow. A, aspirin when appropriate. So you and your provider talk about that. You have to get that information from your doctor. So I'm just reading the ABCs according to the CDC. B, blood pressure control. Control your blood pressure. You can't control what you don't know. So accepting the idea and reality that you need to check your blood pressure in order to control it. Check it. Okay, yeah, I'm that type of person that when I take care of my patients, or when I'm working on the field in the area, I don't believe in sugarcoating anything. Okay, take your blood pressure, know your number. Cholesterol management. So, how you manage your cholesterol? Again, I'm not your provider or a doctor, but I have common sense, and some of this information that I can say I've tried and it works. And so you want to change your eating habits. Try to move more. See where your numbers is, and talk to your doctor about the certain medication. Make sure that your medications are not adding to the problem. If they are, ask your doctor how to fix that and not add to medication. But let's fix the problem. Okay. If you are a smoker, try to stop smoking. Now, because of my experience in the medical field and as an insurance broker, most of your plans will help you with this information, and sometimes it will not be a cost to you. There's preventatives. This is preventative measures. There's preventative management. That is part of the essential health. And you can find that if they are not already mailing the information to you, or if you have care managers contacting you. Sometimes just talk to them. That's free advice. It ain't really free because you have health insurance that you're probably paying for. If not, you had to qualify for it if you got a subsidy. Regardless, the information and the education is available to you. Rewind the video. And there's providers that provide information to you, and let you know that they are doctors. So if you don't trust me, trust someone, but out of all means, accept reality for what it is. If you're not feeling right, check your numbers. So, and with all that being said, for the basic information that is good for you, good for me, and I actually enjoy providing it to you, and I can say that I've tried it and it works. I'm giving it to you. Okay, so you want to make sure you get plenty of water. Okay, try to eat whole grain and fruits, vegetables. These things help you with your blood pressure, your heart, all the diabetes and the cholesterol. It collaborates just like we are going to do with the communities. So you get good news, you spread it. All right. So while we're in the community here, we're exercising and you're providing stress-free mind information to help others to be stress-free. You're getting some exercise, you're getting vitamin D, you're getting some sunlight. I mean, it's all in one. So take a holy apple, okay, and enjoy that apple. Trust that that apple will provide you with the nutrients, the uh, apple a day, keep the doctor away, help you keep the doctor away, and walk by faith, you know. But faith without works is dead. So do the work, do it. Find a group in your community to help you with your health goals. I said health goals. I said health goals. I meant lifestyle, because we don't just want to get off the medicine. We want to live and stay off the medicine. We want to improve or help the medicine help us if it's a genetic and something that is just part of the gene. Eat right, eat better. Let's take this journey together, okay? We can do this, right? There's nothing we can't do without the power of God, right? Because God is over everything. If we trust in Him, we can do this. He has in his word the ways of life and lifestyles and that we can share. There are scriptures that can help you with overcoming the denial and healing scriptures all through the Word of God. We know He said, cast your worries and burdens, whichever word, and depending on the Bible you're reading from, on Him. Okay, and we lean not into our own understanding, right? So, let's do what we can do. Yes, as a CPR provider or instructor, I want to help save lives, but more importantly, I want you to save your own life and do what you can do for you so we don't have to give chest compressions. We don't have to uh, revive you because you can do it on your own. There's nothing more important than independence. Okay? So enjoy your day. Enjoy your day. And